Okay.
Yay. Okay, I saw that.
Mhm.
Okay, excellent. So Ian had a proposed agenda, and it's basically just two items. One's the update on what's going on with the clinic, and the other is anything we can think of on affordable housing, because stuff's hitting the fan, which is a good reason.
Okay.
Do you have anything else that you want to add to that agenda?
No, I'm just full of kind of some information and questions and pondering
Sure.
about the clinics. So,
Yep.
um,
Well, let's start with that first.
okay.
So, how'd things go?
Our numbers were really, really low. We only had one child and
Mhm.
5 adults. So I think
That's not a lot.
what?
That's not a lot.
No, no. And we gave out very few of those rapid tests.
Right.
So it was stunningly low attendance. And I hope that it's not simply because of Super Bowl, but that's could be just a cultural thing that
Sure.
we didn't expect for. But one thing that really caused, I think, the massive slowdown, at least for the pediatric side, was that Lane County Public Health had pulled back their services again because they said they were restructuring. And so I
Right.
had to go to the state of Oregon and ask them to send one of their field op teams, which they did. And that was a stunning group of folks that had been, like, they were from Tennessee, Louisiana,
Wow.
Massachusetts. They had been living in hotel rooms for months and months and were part of the mobile response teams.
Mhm.
And so it was really fun talking to them and kind of learning more about their what their experience was like. But at the end of the day, because that system that we had to pull or utilize didn't have a signups process
Ah,
because they're mobile
right.
teams with the state.
Right.
So I wrote to Lane County Public Health right away, and I just said, look, we have to have continuity. Like,
Right.
like all of the Eugene Weekly ads that we funnel into,
Right.
the website, the Whitaker Community Council website, all
Mhm.
these links go straight for pediatric care to Lane County Public Health. So without their help, we need to either like radically shift all that away from that, or so I'm just hoping that they can provide some consistency, because if we could just get them to accept for the next couple clinics, that's going to create a really nice new wave of folks that come for one and then bring their kids back for the second. And I
Right.
think in this age now, I think that's a really huge important thing for parents, is to have an appointment with their kids, because it can be a hostile environment. I hear from other CBOs around the state that their kids' clinics, there's protesters, there's problems. So anyway, my
Right.
hope is that we can do this. But in other news, those mobile teams were talking about how they're leaving the state and
Mhm.
returning home on February 28th. And then Whitebird also, I talked to them, and they're going to be suspending their vaccination services coming March.
Mhm.
So they said they'll stay on with us, which is great, through June. But yeah, it's
Oh,
just
wow.
really, it's a real interesting dive here as we go. And then I thought it was interesting. I thought of you today. They had the community listening groups on Zoom, which is like a huge group of all the OHA folks and, again, CBOs from around the state. And there was a lot of talk on there about how we're not addressing folks with immunocompromised systems.
Right.
And so people were really trying to ask the representatives why the mask mandate was being lifted when we have real crisis among our vulnerable communities.
Yeah.
And speaking to like the justified sense of like, this is about ableism, and so yeah, there was a lot of heated tensions today on that meeting, but here we go, right?
Right.
So
Yeah, there's a lot of factors involved with them lifting the mask mandates. It looks like they're primarily looking at how many beds they've got, especially in the emergency care sections of the hospitals. But they're also concerned about the fact that the hospital should be more than just COVID patients. They've always got people who have heart problems, liver problems, kidney problems, you name it, and there hasn't been room for them, which means a lot of people have actually been dying just because they couldn't get into the hospitals and get the care that they needed. So this is going to be an interesting experiment come beginning or the end of March to see what happens, and we'll be watching very closely. Not that, we're going to be in a position to change anything. I mean, it's a state mandate, so what are you going to do? But I'm sure we're all going to be kind of watching the graphs very closely. Lane County does have their own person watching the demographics and watching the numbers go up and down. Her office is just down the hall from mine. But I don't know. The CDC did just come out with new recommendations on vaccinating people who are immunocompromised too. So for the most part, the only real changes was shortening the distance in time between the third and fourth vaccine, because they're actually using 3 as a base with a 4th as a booster for people who are immunocompromised. That varies depending on the compromise that they have. But yeah, there's huge things going on out there. And yeah, I don't know. It's a huge mess.
Yeah.
But that's always going to be the case when you have something like this. I mean, this is one of the worst types of pandemics because it's airborne. It's in some ways you can protect against that, in other ways you really can't, at least not forever.
Right.
And the variants, we never know when there's going to be another one of those.
Yeah, I mean,
So,
from your line of work and where you're, excuse me, from where you're,
that's fine. I've got a house full of cats too.
yeah. From where, you're standing with your line of work in Lane
Yeah.
County Public Health, is there kind of some word to the ground that, okay, if there is another variant, things are going to have to just reverse and we're going to have to go back to
At this point, I don't think it's going to be in our hands because it's a state stuff. It's not a county thing. I'd say a lot of us are really nervous, but there's not, I mean, the nurses don't control things.
I know, but no,
we're just the cannon fodder.
right.
So, but we're concerned, and we'll just, I don't know. Jason is the voice of Lane County Public Health, and I can't really say anything. So I'm not gonna,
Right.
but I can say just for myself, I'm nervous. So that's all I can say. We will all be watching very closely.
Yeah. It seemed like with the clinic that we had, last Sunday that was so poorly attended, it almost felt like, well, gosh, maybe we should, suspend, service or something, or just like wait it out a little bit. But that's not going to be realistic because we just have to be ready and prepared in case, another variant pops up and we're right back to square one. So
something else I have heard though, and I didn't actually hear this through official channels, I heard it through the media, but I've heard that they're talking about actually doing vaccine clinics for children in the schools directly. So I don't know what's coming of that. I hope they do it.
Yeah.
I hope it works, but they haven't really done it that much for other vaccines. I mean, so I'm not really sure how that's going to pan out.
Yeah.
But something's better than nothing. But I don't think we're in a position that we should stop ours just yet.
No.
For the reasons that you voiced. We're not really sure where this is all going just yet. And just because we didn't have anybody there, well, very few people there. Well, honestly, anybody's better than nobody.
Yes.
I mean, the thing is it's so incredibly contagious. And it was Super Bowl and a variety of things.
Yeah.
But yeah, I'll do whatever I can to help keep things going too.
Good.
Thank you for everything that you're doing. It's great. Do you know how many of the test kits we actually did give away?
I think only about 9.
Okay. Well,
So
at least we've got a bunch of them. We all sat and made all those up. So
yep.
we've got plenty of them left. You're talking about possibly giving some of them to some of the businesses.
Yes.
Did
Yeah.
any of the businesses say they were interested?
Well, that's the thing. I'm kind of strategizing now how to do that because I feel
Sure.
like we should probably just make some decisions about how many should go to a business, and which is
Mhm.
arbitrary because each business may have specific needs and employee
Right.
rates. Um, like if Nikasi, they'd need hundreds and or
Right.
more than we have. So
Right.
yeah, it's a little arduous to try to plan it out because of the wide, just, range of business types. But
Sure.
um, yeah, I feel like we should get them out into people's hands. So I guess maybe
Absolutely.
maybe just a social media post and then people could respond and then I could just take kits around or something.
Sure. That's
Yeah.
fine.
Do you
I
know of
mean,
any?
we could, I don't offhand, but the thing that immediately comes to mind is those businesses that may have already participated in some of the stuff that we've been doing.
Mhm.
I was that one over on what, Third or Fourth Street that we set up a clinic at.
Oh,
I can't.
Alluvium?
Uh,
No.
that wasn't the one I was thinking of, but they'd be good too
Oh,
if they don't have any.
the hybrid gallery.
Hybrid, yeah.
Hmm.
That might be a good place to ask, see if they're interested, because they're already involved in the kind of the health thing anyway.
Yeah.
So it might be something they'd be interested in doing.
Okay, that's a great idea. Red Barn,
Sure,
places where we bought our incentives from.
right.
Yeah, that's a
Well,
great idea.
the other thing about that is, of course, they're not only a really key part of the community, but because of what they do, they have a lot of direct contact with people,
Mhm.
and so making sure that their employees are tested is fairly important. So
Indeed.
it's, you know, anybody doing retail is probably going to be in great need of that kind of thing.
Yeah,
It's, I mean, Ninkasi, I suppose, but most of what they do is manufacturing, and so it's not quite as critical.
good point. Yeah, we do have 900 kits coming through the
Oh,
federal
wow.
program. Yeah, I just ordered
Cool.
the maximum that we could for
Sure.
our our group. And then I also was able to order, I think it's almost 2,000 N95s and
Good.
then a bunch of couple hundred like packs of sanitizing things. So that was
Sure.
kind of my plan, is to wait a little bit longer till I know when we're getting all that, and
Hmm.
then maybe get some volunteers in my driveway or something, and we could kind of like break it all down into packs, for
Sure.
businesses, and then deliver them in big lumps like that. So
Hmm.
yeah, that should be pretty exciting to be able to provide more than just the kits,
Right. Sure.
gear too. So
Absolutely.
yeah, hopefully we'll hear from that. That was kind of part of the same rollout through OHA that was in tandem with the Biden plan where you could
Right.
get the 4 kits at home. So
Right.
yeah, it's going to be a lot of equipment. So
Well, okay, that all sounds good. So the next one's going to be, there's exactly, I don't know, there's 29. There's 29 days. No, I'm looking at the wrong map. Wrong count. Wrong calendar. No, there's not 29 days in February this year. It's 28 days in February this year. It's 2
okay.
years from now. That's right. It's every presidential year there's 29. There's 29 days.
Oh,
Unfortunately, it's not. Fortunately, it's not a presidential year. Thank God. Um, so that means the next one is going to fall on exactly the same date in March as it did in February.
yes.
So that's a good thing to plan on.
Hmm.
Uh, all right. So
Wait,
what would we want to do differently this next time? You're saying, is there any way we can get uh, Lane County Public Health to kind of say something other than just no? Um, what is
I'm
it? What is
trying.
it? What is it that they're looking for that we might be able to provide for them that might make them more interested? My concern is if they're saying they're they're trying to redo things or do things differently. What does that actually mean? Did they explain it to you, or that were they just really nebulous?
Well, it's evident by the handoffs that I'm getting.
Right.
It was Sarah, then it was somebody else, or no, then it was Abby, then it was, and now it's Lorian. It keeps, they're really
Right.
restructuring and changing around who's in what roles right now. So
Right.
my letter to them, yesterday was just, kind of pointing out the efficacy of their pediatric services with us
Right.
for December and January. I mean, that was over 170 kids or in total, or 160 kids. And
That's a
I
lot of
said,
kids.
compare that to one, and we want to keep working together because we've created a continuity with our Whitaker families, and
Right.
they know that this is where they can go easily and get great stuff and feel warm and welcome. So yeah, well, I hope that we'll have a better run at it, because as awesome as the OHA field op team was,
Sure.
that's just a real hindrance if they don't allow a sign up system.
Right. Yeah. The Lane County was providing more services that allowed us to actually access clients better than OHA can. And
Yes,
that's perfectly understandable. Um,
very true.
so you wrote a letter. Do you think anything else might be good to be gone? Well, what is this what's this person's name, and do they have an official title for their position?
Let's take a look here. It's interesting because I recognized the woman. She was the former event coordinator over at LEC.
Ah,
It's Lorian Madrigal, and
ah,
I'm trying to see here what her title is.
okay.
I think she is the like team coordinator.
Okay.
Sorry, let's see, where are we here?
That's fine.
Got so many emails. While I'm looking for that, I've got some other really neat news for you though.
Oh, good.
Oh, there she is. Okay. So her title is COVID-19 Field Operations Clinic Coordinator.
Wow, that's great.
Yeah.
COVID-19. Say that whole thing again. COVID-19
Field
field
Operations Clinic Coordinator.
Got it.
Okay.
Thank you.
Lorian Madrigal. So again, I felt really fortunate to have her come into my inbox because again, we've worked together on other big projects that I was doing for KLCC over at the LEC.
Nice.
Yeah, so it was great to know that she and I had worked before. So yeah, that might be a really good way to just feel positive about waiting for the answer. So but yeah, the other neat thing I wanted to tell you is the Shelton McMurphy Johnson House reached out.
Oh yeah.
And it's really neat. They're doing a exhibit with medical supplies and historical artifacts from the beginning of vaccines to our current mRNA vaccine. So they've got a really neat thing. They've collaborated also with the Science Center and NAACP and I think the Eugene Cultural Group. And so we're going to actually be at their opening week, and we will have our yard signs all leading up to the mansion. And then
That's
Go
so
ahead.
cool.
Yeah, it's really sweet. And then I've got Whitebird to agree to come and do vaccines on site from 1 to 4, just like we would normally be doing our clinic. So we're basically moving the clinic to the mansion for one day. That'll be on February 26th, which is a Saturday. Wow. And it's just going to be super neat because we kind of strategized how we would work through the vaccines and booster process. But we'll have our normal WCC volunteers on board, and they'll kind of be like little exhibit dossier docents, kind of like if someone gets a vaccine in the little parlor room, it's going to be the little cute room off to the right. And they want to go ahead and look at the exhibit on the ground floor, they can kind of be accompanied around during their observation time, and circle back over to the checkout person that Whitebird uses. But yeah, really fun. I'm super excited. And then we were able to order a bunch of those fun swag bags from the OHA. So so everyone that comes in and out of the exhibit will have one of those. So yeah, really fun.
That sounds so incredibly cool. I wonder if there's going to be any media coverage.
I'm sure there will. Leah, who's the ED there, has been working really hard on this event. So I would be pretty certain there would be. Let me
Well, that could be really handy.
Yeah. Let me send you the flyer. It's really sweet. Here it is. I think it'll go through in the chat. Yeah, I was excited to do that. And our volunteers are thrilled too. They were just like, what, the mansion?
Oh, sure. Absolutely.
So great.
So I'm wondering if we could possibly use that event somehow to advertise our next clinic over in March.
Yeah, that's a really great idea. And I will ask for Emma to get
there it is.
Isn't that cute? I'll get a new flyer made from Emma. And we can have those passed out there.
Ooh,
yeah,
nice.
Isn't that
Look at
sweet?
that.
Yeah, that's going to be really sweet. So that's just a draft, but they're going to make another one that has us in it. And yeah, I was really excited this last week before the clinic because we had those canvassers with new grand strategies. And I had Instaprint, hand off 200 or more of these little mini flyers for the clinic. But it didn't work, but at least it may have. It could be the 5 people that came. We don't know, but
maybe.
Yeah, but it's a good way, I think, to continue our kind of paper offering of events, but not have them torn down and thrown in the trash, which was happening all over the WIT. So
that's sad.
Yeah.
So this probably isn't a big thing, but I do think I should at least mention it. I have had people who know me call me and said they did not know how to get to the clinic because of how weird the streets are there. So I've mentioned it before, and I don't really know exactly what to do about it, other than the fact that I was concerned it was going to happen, and it turned out it actually did. Those people who called me, I was able to explain it to them, and they were able to get there, and it was fine. But that's just a really weird place.
I think, someone else told me that on Sunday as well, that because there's no bus line there, it's a problem. And then somebody had tried to put the address into their Google or their directions, and it didn't work. So I'm going to add to flyer design, if Emma can do this, to make a little map of the Eugene mission space so that folks can see where to go.
Having West First extend someplace else for 1 block. Yeah, that doesn't make sense to people. I mean, it makes sense if you've lived there, but if you don't, it's just
I also wondered if folks didn't come down there because the condition as you turn the corner there onto First.
Yeah, I saw that. That's a first. That was the first time it's been that bad. That was kind of interesting. I was wondering how the mission was feeling about that, because they're usually not very patient with that sort of thing. I was kind of curious as to how that happened. Yeah, that's really interesting.
Yeah, that was rough. Yeah, I saw kind of a almost violent act just leaving that day. That people in the corner there are just really experiencing severe crisis. And I thought the same. I thought, well, the mission's got to get over here and, give some help or do something. But I think the people living on the corner there are the ones that were over across from the new Nelsons and were
Ah,
having such a hard time. It's a very unique group of
mhm.
folks, and I think that may be their new spot. So, yeah.
Yeah,
So that leads us to,
interesting.
yeah, that's probably just going to continue to get a little rough as folks are moving away or out of the park, right?
Well, that kind of leads us into the next batch, which is the affordable housing.
Hmm,
Yay.
yes.
So, as you know, we've been trying to get somebody over from East Blair Housing Co-op because um, for some months now, there's been a recognition that there's obviously not enough for affordable housing. We have lots of examples of it in Whitaker. We have East Blair, we have Emerald Village down at the end of my street. Uh, you could even count over on Cross off of North Polk. There's a mobile home park. Manufactured housing is one of the original low-income housings,
Mhm.
right? There's what else is there? Oh, so the folks who developed um, uh, Emerald Village, Square One Villages, they're selling themselves as we build cooperatives, right? So I don't know that much about that particular thing, but give me just a second. I actually have their website that goes into it. And I actually was hoping eventually somebody from East Blair could kind of look at what Square One is saying about their cooperative vision and compare it to what East Blair does and seeing, how does that jive and how does it not? I mean, is this a real thing or are they, kind of like blowing smoke? I don't know. It East Blair is real and um, Square One Villages, they're doing something. They're doing some good things. I just don't know how far they're really going to take it. Give me just a second while I see if I can find this.
Sure.
Da, 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 da. Yeah, I think this is the one. This is their little outline of what cooperative housing means to them on that page there.
Okay. Oh, thanks. All right.
So there's two major distinctive things about the need for affordable housing. One is obviously for people who are already currently without housing.
Yeah.
But the other one is for people who are probably about to lose their housing for a
Hmm.
variety of reasons, not the least of which is the pandemic is causing problems for the economy and people whose jobs don't really work as well as they were before, and the fact they couldn't pay rent and those rent subsidy things stopped. And so now we don't know exactly what's going to happen. And part of that's because they're not cooperatives. The housing is owned by people who are doing it for profit. And one way to address that, of course, is to develop more housing co-ops so that at least we're taking the profit motive out of it. There's still going to be cost. It's not going to be free, but at least it's not going to cost as much as it would be if you're getting it from somebody who is doing it because they're trying to make a bunch of money off of it. But there's other things too, and that's why it'd be really nice to get people who are involved in all the various forms of low-income housing in Whitaker that already exist to kind of sit down and talk about what they're doing right now to get ready for what's going to happen. And what I mean by that is Governor Brown just said she's going to be throwing out a bunch of money to help develop low-income housing. And I'm very interested in seeing where that goes. Ian's really good at finding grants. He knows where to go to look for that stuff, right? But the thing is, the money's no good unless we have some sort of plan. So the idea is, at least I'm thinking, if we can get some sort of idea of what's going to work for Whitaker based on what has already worked.
Right.
Setting the precedent has already been set. What's worked? What can we do more of that we already are doing? So, generally speaking, people who do grants like that sort of thing. But I've been having a terrible time trying to get everybody together. I thought I'd start with East Blair, thinking that would be simple enough. Hasn't been that simple. But I guess the next batch of folks. So when East Blair originally started, they did it in conjunction with what was Nedco and is now Dev Northwest. So I expect we should probably get a hold of them, as well as folks from Square One. And I'm not sure who else, but I would think somebody to talk about manufactured housing too. The biggest problem with mobile home parks is that the people who own the property are generally in for a buck. In fact, I don't know if you ever watched John Oliver's show, but he did a great exposition on how large investors are buying up mobile home parks and jacking the prices up because they can, right? But I can imagine a cooperative buying property and setting it up instead, where it would be a much more economical sort of thing. So I don't know what else we can do, but getting folks together to talk about and outline some sort of plan on whatever can be done. Finding Ian's pointed out we got to look at the laws surrounding what sort of buildings can be put up and how they can be used. There's been some changes in those recently to help accommodate people to make it easier to do low-income housing.
Yeah.
But I don't know what that is, and I expect we need to have somebody who's an expert in that field to be able to walk us through what the process is. What's already happening? Are there further changes we would like to see so that we can do more? So I guess what I'm asking you is if you know people or where to look for people who might be able to be found that are experts in that sort of field. I guess you know any lawyers? You know anybody who works in the sort of fields that might have to do with the rules that are set around housing in Eugene and Lane County, or how to find them?
Well, it's an interesting question, but if we could go back just one step.
Sure.
Because, yeah, take a look at this. This is a really new, exciting thing. Just recently, Lane County said, as part of their way to address our housing issues, they would limit price cost that you would normally have to incur to make an ADU on your property. And so they've also, like, I think a lot of the permits.
Is that like the development costs or something?
Yeah, so the permits are all being waived, and then they're literally giving these blueprints that are pre-approved dwellings
right.
to people for free. I think there's several that are free, or then there's another group that can be downloaded that are low cost, and they're a little bit different. But all of these units to be built are energy efficient, accessible, low cost. And they were really trying to address how homeowners could utilize the space they have to create more sustainable housing. So when we think about the WIT, it's like there's not a lot of available land mass,
Right.
So I think of all the friends I have that have land, and I'd say maybe, or that own down there, and there's probably,
Sure.
I don't know, maybe 2 that would even have space to do it. But I think that by working with what's something that the city has, graciously offered, to connect those dots with people that own property already. I mean, to me, that's kind of like the low-hanging fruit. to start with, because, again, when we think about where is landmass available,
Right.
I can't really think of any big spaces that are left, right? So like what you're saying about the mobile home park and stuff,
Right.
but probably, I looked at Google Earth the other day. Because I was looking for some of the information regarding the other crosswalks and intersection murals project that we're doing with Dubcat.
Mhm.
And I remember thinking that it's such a tight space. Everything is very tight. So it's kind of a gamble, but that would be where I would start, would be immediately like, let's identify folks that would be willing to take this on, because
Sure.
it's rent for them, and it's an initial investment that can be hard for some people to absorb. But if you have all that stuff wiped off at the top, all the other costs that are so incredible, it might be really attractive to some people to try.
Well, this would address some of the issues in terms of just the space. I don't see any reason why you couldn't also graft on the whole cooperative idea in there. It could simply be done so that people can make money off the rents. That's certainly a possibility, and I got nothing against that. But the other thing is, homeowners could work with a cooperative who could assist them in terms of helping to pay for the construction,
Oh,
to
yeah.
to actually say, look, if you allow this person to be on your property, we'll pay for this, and all you have to do is just let them use the space. So there are other possibilities. In terms of dealing with the space itself, you'll note that one of them, so they've got 6 designs that they're showing here.
Mm-hmm.
On most of them are things sticking out from the house or detached from the house,
Yeah.
but there are 3 of them that are either on top of the house or below the house or on top of another existing building. Those don't increase the footprint of the building at all. And so it's interesting because I have a 3-foot crawl space underneath my house. I own a duplex. I added on a section to it to move my mom in because she was getting really elderly and couldn't really do things by herself. Now she's gone. Her significant other's still there, but I really do like the idea of adding on to the building or doing something else to make it so that more people can exist, just so they could just live, for God's sakes.
Exactly.
So yes, I'm very supportive of this idea. I think it's a great idea. I heard about it before. Thank you for bringing it back up again, because it had kind of left the back of my mind.
Sure.
But yes, certainly this is certainly something we should be proposing.
Mm-hmm.
I don't see any reason why we can't do it along with other things we might be doing too, because as you said, well, I don't know for sure if you said it, but people may consider it, but they may not consider it if they don't have the money to do it. So if we could get an organization to work with us to fund doing these things, if people are willing to let their space be used for that purpose, they could have separate entrances. They wouldn't have to go in the main house at all, even if they're attached. It's simpler to design the plumbing if you're just using and the wiring and stuff like that, even if it isn't attached, if you're not having to extend it, if you're not having to do it completely separately. And that might be an interesting thing too, is getting somebody who actually knows how to. Okay, I'm sorry, I'm getting way ahead of myself. It's a great idea. Thank you.
Yeah. Oh, you're welcome. And just one quick side note too, that was
Sure.
also amazing with the program is that they actually reduced, oh goodness, what is it called? Oh goodness, setback requirements. So for instance, right, if you behind my house, I've got my neighbor's house, but I think if I judiciously took a tape measure with these reduced setbacks that the city is allowing, I could get one of those behind my house now because they've reduced that. And I think that really speaks to, better urban planning and, because, a lot of folks have way more than they need in terms of yards and rambling spaces. And certainly we love them, but one of the beautiful parts about the WIT is that you can walk to the river and we have all this beautiful, so it's not like giving up space in someone's yard would make them bereft of nature, so.
Right. Oh yeah. Yeah, it's true. It's a good point. Yeah, we're surrounded by it. We're next to it. We're in it. Right. So that's a good point. So I'm just thinking next steps. I mean, it would be nice to bring something to one of the general membership meetings, at least just to let people know what we're considering, and invite people to come to the public health meetings. But I also want to start inviting. I mean, we keep asking East Blair and they keep not showing up. Okay. So I don't really want to beat that to death. But I do think we have had people who live at Emerald Village come before. When they first started, we had a few people who lived there, and I would kind of like to have either a couple of them. Hi, Margaret. I would kind of like to have you them or people who help run it. They say it's a cooperative, so I'm very interested to see how that all works out.
Hi, Margaret.
Yay.
Sorry, I'm late.
No, it's fine.
It's okay. Glad to see you.
I'm glad you made it at all. That's great.
And actually, Anand, that does make me realize I do know a lawyer that handles real estate law. So that that may be a good start. Like connect some dots in that way and see like what is possible.
Right.
Before making a plan or. Sure.
I mean, do we have the legal pieces we need to even do? I mean, this thing that you've got about the ADUs is great. What are the ins and outs of that? What do we need to know before we start trying to push forward with that? Is there something else that needs to get changed? As I was saying, you said no permit fees. One of the things that stopped a lot of other neighborhoods from building more of the tiny villages, people have told me, has been that the development costs are the same regardless of the size of the building.
Right.
Which is incredibly bad for low income and small housing. I mean, you're charging the same for a McMansion as you would charge for a tiny home. That's crazy. Yeah, we need to know some details about that kind of thing, and if whether or not, I mean, so although East Blair is a great cooperative, and I'm very happy they're there, they don't seem to be terribly interested in coming to these meetings just yet. Maybe later, but if Square One is saying they're doing cooperatives, maybe we can get somebody from there. As I posted in the chat here, Margaret, you might want to take a look at it. The Square One Villages talks about how they view housing cooperatives, which they say they're doing, and seeing if we can get somebody from there to come to one of our meetings and discuss the ADU issue. You know, can we somehow combine the idea of doing ADUs and cooperatives so we have the cooperatives funding those, so that if people are willing to let their property be used, but they don't have the money, we can still find some way to actually get some of those things built. I don't know. It's just a thought, but that might be another reason we need to talk to somebody about real estate law and stuff like that too. You know, I'm not sure what the ins and outs are. Hi, Margaret. I can see you think. I can see you thinking. I like to see you think. It makes me think too.
Thinking is a good thing.
Thinking is a good thing. So one thing I wanted to mention to you, Margaret, because I've been trying to tell to everybody, be nice to yourself in February. February is a sucky month. What I compare it to is When people who are very depressed first start getting on antidepressants, the problem is their mindset is still not good, and yet they start getting their energy back. February is like that. We're still kind of like in that winter mindset, but the sun's starting to come back and we're starting to get a little bit of energy, but that can not be good if we're not real careful about it. So it's really important to be good to yourself and be nice to each other if you can. And yeah, just February sucks. So just be careful.
It has been a hell of a ride. I will. So I got COVID. I don't know if you knew that.
Oh, dude, I'm so sorry.
And it was I ended up having to get the antibody. I
I'm
actually
glad-
got it on the 9th day, which I was very lucky. I was calling my doctors and screaming
Oh,
and
wow.
yelling. They didn't even tell me.
Oh man.
I might still have it had I not got the antibody.
Whew.
And it put me into AFib,
Oh,
which was
shit.
not good. So you can
No.
see now I have this. I'm burned. I just
Oh,
had
wow.
a cardioversion yesterday,
Oh
Mm.
man.
and I have it's a big old where they put the pad. You know, they
Yeah.
shocked me, and it went back into rhythm, which is great because I'm
Yeah.
going on vacation next month.
Good. Yeah, me
I'm gonna go
too.
snorkeling and get in the ocean
Oh,
and
that's
walk in
great.
the
Yes.
jungle.
Yay.
So I had to do
Good for you.
something because I couldn't
Yeah,
even
yeah,
walk
yeah.
down the street without
Oh
being.
man. Right.
Yeah.
So
Oh geez.
it's just getting better from here. That's
Good,
all I have to say.
That's great.
Good.
I did not hear about that, Margaret. I am so sorry, but I'm glad you're taking care of yourself. And I'm so
Yeah.
glad that you can advocate for yourself because yeah, our system is not great. If you can't advocate for yourself, things don't turn out well sometimes. So I'm glad you were able to do that. Feel
Well,
free to get a hold of me anytime if you're having a hard time with the medical folks. I will be happy to go punch somebody for you.
I've had my primary care. I have about 4 doctors,
Right.
and I've had them for very long term, and they know when I call up and start complaining that I really mean it because I don't usually complain.
Right. Right. Good.
And I've had them long enough to where they take good care of me. They
I
sent me
think-
to the
Great.
ER. I couldn't have had nobody could do a cardioversion for me for 90 days because I had COVID.
Right.
They're not doing any, they call it an an elective procedure,
Oh shit.
even though it could kill me because I was an AFib.
Right.
But they cannot do it on an appointment basis for 90 days after you have COVID, which means if
Wow.
you have cancer, which means if you have liver failure, which means all of those things, if you
Right.
have COVID, at least at OHSU, which is where my cardiologists are,
Right.
they cannot do anything for you for 90 days. And they're the ones, they told me, they said, just go. They sent me all of my downloads. You know, they download my
Right.
defibrillator every night. I have a little Bluetooth thing next to my
Sure.
bed.
Mm-hmm.
They sent me everything in email. They said, just take this into the ER and just be your demanding, overbearing self and tell them to give you a fucking
That's right.
cardioversion.
That's right. That's right. That's right.
And that's what I did. And it was great. And there was no one in there. I went to River, or to not to River. I actually don't like Riverbed very much. I went to
Don't blame
Mackenzie
you.
Willamette,
Yeah.
and I got right in.
Good.
So that was good.
Good job. Yeah. I remember you telling me, I think, or something, that there was only 14 doses that day and you were getting one. So that was good.
Well, the first one, they told me I couldn't get it all. And then I had to call the doctors back and they didn't call me back. Anyways,
It's been rough. Yeah.
I
So glad.
I
You
think
look so
it's
much
worse
better.
than they're telling us from my experience.
Mm-hmm. Yeah. Good thing
It's
that
Ian.
worked out. Hi, Ian.
Well, Margaret, all I can say is make sure you write that story down because people are going to need to hear it.
Yeah.
Okay,
I'm-
one last thing before we hand it. It's getting close to 7 o'clock. So we had some discussion about various things. just to wrap this all up, didn't have that many people at the clinic, but we do want to see if we can get more cooperation with Lane County and whatever that takes. I might have some people I can talk to as well now that I know a couple of other things. So we'll look into that. Affordable housing. Doriandra pointed out that the city is trying to make it really, really easy to do the ADUs, the accessory dwelling units. And we're going to be looking into that. We have at least 2 different places doing cooperatives. There's East Blair, of course, but there's also the Square One Villages folks who did the Emerald Village down here. They're saying that they are also building cooperatives and seeing if we can get some more a cross thing. You know, can we get cooperatives helping with the ADUs? Is that a possibility? And Doriandra said she's knows somebody who might help us with some finding out some real estate legal stuff, finding out what is it would take to be able to do these various types of things. What is it that we need to know? What is it we don't know? What's actually possible? Because we already have lots of examples in Whitaker of low-income housing, and trying to figure out other ways to do more of that. That's about where we're standing right now. We're going to do more later because we gotta, because it's not going to happen by itself. But thank you, Doriandra, about bringing up the ADUs. I had forgotten about that. That's definitely got possibilities, especially if we can figure out ways to fund that on top of everything else. And that Sheldon McMurphy House thing. Oh, that's so cool.
Mhm.
So what was it? It's in February the 28th. You were saying?
It's going to be Saturday,
26th.
26th. Yeah.
Yeah, Saturday the 26th. So
Mhm.
that will be very cool. Okay, I'm
Yep.
gonna shut up and hand things over to Ian because I have to go get some dinner. So it's been fun. Thank you, Doriandra, and thank you, Margaret. And I'm so glad you're feeling better.
Good
I'll-
stuff.
I'll-
Thanks, Anand.
I'll be back in a little bit. I just got to go get something to eat. Bye-bye.
Thanks so much. Would you mind pressing stop on the recording, please, Dorandra? And then I'll get the